Hello, everyone. This is Senior Biotech Analyst John Vandermosten. Welcome to our channel that educates the life sciences investor on exciting advancements in drugs, biologics, and devices. For more content and news like this, subscribe to our channel below and like or share with others. We're back with Reviva's CEO, Dr. Laxminarayan Bhat. Your lead candidate, Brilaroxazine, is an atypical antipsychotic in phase 3 clinical trials for schizophrenia. Tell us about the class of drug and how it addresses some of the shortcomings of what's now in the market.
Yeah, the current treatment options are suboptimal to treat schizophrenia, as well as they are reported to cause several undesired side effects. Now, with respect to the efficacy, the schizophrenia is not a single disease, rather cluster of few symptoms. The major symptoms are positive symptoms, negative symptoms, and mood symptoms, cognitive impairment, as well as immune system abnormalities. So besides that, the treatments are known to cause several side effects. Our drug, Brilaroxazine, based on the data generated to date, we believe this can significantly address the major symptoms, as well as with a minimal or a very clean side effects profile. So this could make a difference in the treatment options when it comes to market.
So, and you have data to support what you just said right there in terms of the side effect profile and the benefits of the drug. You conducted what was the Refresh phase 2 study a few years back. What did this placebo-controlled trial show, and how did it give you confidence to move into the phase 3 that you're now running?
Sure. First of all, now we are conducting phase 3 studies for Brilaroxazine in schizophrenia patients. So prior to starting phase 3 study, we completed 2 studies in schizophrenia, one in stable schizophrenia patients population, and then second one is a large study, global study in acute schizophrenia patients. So the data generated in the over total close to 300 patients population, it is especially in the acute schizophrenia and schizoaffective patients population. So it showed 20-point improvement in total PANSS score. PANSS is a scale used for evaluating schizophrenia symptoms.
And we'll include a link to our report so you can get details on how the PANSS score is calculated, and what elements are in there.
Sure.
But, yeah.
And then the main summary, the take-home message here is the drug has shown good efficacy on the primary endpoint, and then most importantly, it showed really statistically significant improvement on secondary endpoints. That's very hard to see in a phase 2 study for major secondary endpoints such as positive symptoms. Most drugs show statistically significant improvement, but it is very hard to see for negative symptoms and cognitive improvement. And then besides, in all the translational model, our drug has shown a reduced variety of cytokines that could be a real treatment differentiating factors when it comes to market, because immune system abnormalities are very hard to treat with the current treatment options. Probably our drug could be a choice for treatment, and then treating the immune system abnormalities can speed up the recovery process, as well as it can significantly mitigate the side effects, especially neuroleptic side effects and then metabolic side effects that we see with the current standard of care or treatment options.
Right, and the side effects was actually the next thing I wanted to ask you about. Those are side effects in drugs for this indication are a lot of times very problematic, and in fact, patients stop taking the drug because of the side effects in many cases. A couple examples: weight gain, sedation, movement disorders are a couple examples of that. Of probably the first and second generation of the antipsychotics. Now, how does Brilaroxazine address? What's the side effect profile for the drug?
So far we haven't seen, compared to the placebo arm, our drug did not show any weight gain. Even there is no increase in blood sugar, and then also there is no increase in lipid profile. In fact, lipid profile slightly reduced compared to placebo arm.
Yeah, actually, I noticed that in some of your data that actually, compared to placebo, some of the markers were actually better than it was actually having other beneficial effects besides just addressing the schizophrenia symptoms. So, we're talking about positive and negative symptoms for schizophrenia. Does Brilaroxazine address certain symptoms better, certain symptom profiles better than other drugs in the class that are now approved?
Yeah, so we believe in all respect, the data generated to date, it is much superior compared to other standard of care. So for example, on the primary endpoint, our drug has shown in 1 month 20-point reduction in PANSS score.
Okay.
And then placebo-adjusted outcome is around 10.5 points.
Okay.
So 10.5 points in placebo-adjusted or 20-point treatment difference, if you would like to compare the data with approved widely used standard of care, they are in the range of anywhere around a 13-point reduction to 18 point. So each point could be translated into almost 10% efficacy.
Okay.
So depending upon which drug one can compare, our drug may be around a 20% to 60% better on the total PANSS score reduction overall improvement. Now coming to the secondary endpoints, they are very important in the treatment of schizophrenia, because the secondary endpoints, especially the negative symptoms improvement and then social functioning and cognitive function, this could be a marker or an early assessment for extending the therapeutic benefits to additional indications such as major depressive disorder, bipolar, or other neuropsychiatric symptoms.
Some of the other indications that you're looking at. One of the problems I hear from psychiatrists regarding schizophrenia medications is that patients don't take it regularly, right? What can Brilaroxazine do, or what are its characteristics that might address this issue that the psychiatrists are always bringing up?
Sure. Treatment compliance is a major issue to address in the treatment of or management of schizophrenia. So most patients discontinue treatment, especially based on the current available literature. In 4 to 6 weeks of treatment, around 30 to 50% patients are reported in the controlled trial, up to 70% in the long-term treatment. This is really a major concern. So what we know so far, that treatment discontinuation is partly related to suboptimal efficacy to treat major symptom domains in schizophrenia, and then also partly related to drug-induced side effects and then tolerability issue. So the combination of this, leads to discontinuation. And then without going into the details of science, if you would like to compare our drug in similar trial, it has shown for the marketable dose around a 12 to 14% dropout. This is around 50% better than, over 50% better than other widely used standard of care. So this could be, derived from the combination of both efficacy, better efficacy or treatment effect, as well as side effects associated with our drug compared to other treatment options.
Well, thank you, Dr. Bhat.
Thank you.
Appreciate the conversation. We had Reviva Pharmaceuticals CEO, Dr. Laxminarayan Bhat. Reviva's ticker symbol is RVPH. RVPH. Thank you. I know what it is. I just missed it right there. So you can find more information about the company down below, where we'll have links to other conversations with Dr. Bhat, and we'll also have some links to research reports so you can find out more information on the company and about the PANSS score, which we talked about earlier.
Thank you, John.